This is Dr.EDIN BROW.D, Consultant Paediatrician from Dr.Kamakshi Memorial Hospital, Chennai. So today we'll be discussing about what is urinary tract infection in children. So why are we very much worried about urinary tract infection in children is that any children with urinary tract infection which is being unnoticed with any other congenital anomalies of the urinary tract will lead on to long-standing kidney disease and hypertension. So in order to avoid that, we have to pick the urinary tract infection early and treat accordingly. So basically, children are very much prone for urinary tract infection. So among those, females have a more incidence compared with that of male children. So there are a lot of causes of urinary tract infection. So among those, I will be discussing about the commonest causes of urinary tract infection. So the first most common thing is hydration. So if the baby is not taking adequate amount of water, like approximately 1.5 to 2 liters per day, that will lead on to urinary tract infection. Another one is self-hygiene. If the baby is not having a self-hygiene of the external genitalia, this will lead on to urinary tract infection. Third most commonest in children is constipation. Because of the inappropriate voiding habits, because of the constipation, baby again will have a urinary tract infection. So next common cause is holding above the urine. So some babies among the children, female children will have a habit of holding the urine, which will again leading on to urinary tract infection because of the long-standing urine in the bladder. So that condition is called as cystitis. So next most common cause is underlying urinary pathology. So if the baby is going to have any congenital anomalies of the urinary tract, we call that example kind of post-urethral valve, which is leading on to reflex of the urine to the urinary tract. So this will again cause a urinary tract infection, which will most affect the upper urinary tract, leading on to hypertension and kidney disease. So what are the features of urinary tract infection? How old will the child present with urinary tract infection is that child will present with specific and non-specific symptoms. So specific symptoms per se will present as high-grade fever. The child will have fever more than 1 or 2, probably with the chills and rigors. And second most common presentation is dysuria, difficulty in passing urine in the form of burning urination, pain while passing urine, or there might be dribbling of urine, and even the child might have a oliguria, which is known as reduced amount of urine output, and some children will have a increased amount of urine output very frequently. So these are the most specific symptoms of urinary tract infection. And some children will present with passing of blood in urine, so that is called as hematuria. And some child will present as a cloudy urine for passing of pus in urine. So these are the specific features of a urinary tract infection. Some child will present with the non-specific features, for example abdominal pain. The most abdominal pain will be in the form of lower abdominal pain condition called cystitis, and there might be a upper abdominal pain kind of back pain. The feature is called as pyelonephritis. So one of the non-specific complaint is abdominal pain. Next one is diarrhea. The child might have episodes of diarrhea, and child might have episodes of vomiting. So these are some of the non-specific features. So any child present with these features should be evaluated. So management per se includes investigations and treatment. So the investigations includes the urinary test. The urinary test should be given in the form of early morning sample. It should be a midstream urine and a clean catch. So before giving the urine sample, the private parts or the genitals should be cleaned with the water and normal soap, and the solution should not be an antiseptic soap, so it will have an impact on the urinary culture, showing a false negative. So it should be a morning sample, midstream and a clean catch. So once you're going to give for the urinary test, the culture report shows whether there is any significant urinary tract infection or not. So based upon the urinary test, the consultant pediatrician will start on the respective antibiotics to treat the urinary tract infection. So this is one part of investigation. Another part, if at all child is going to have a recurrent urinary tract infection, at least 3 to 4 episodes of UTI, urinary tract infection in 1 year. The next investigation is ultrasound abdomen. So ultrasound abdomen is done to look for any congenital anomalies of the urinary tract. Certain conditions called post-urethral valve will present with reflex of the urinary back into the upper urinary tract. So in this case, the child will present with end renal stage disease and might present as a hypertension also. So in that case, to rule out the congenital anomalies of the urinary tract, you have to do an ultrasound abdomen to look for any problem with the kidneys, the ureters, bladder and the urethra. So next investigation, if at all there is some abnormality in this ultrasound abdomen, you have to look for another investigation that is called as MCU, which is called as micturating cystourethrogram. This test should be done 3 to 4 weeks after treating the child with urinary tract infection. This test is done to look for any reflex of the urine back to the upper urinary tract. If at all there is a reflex or registration of the urine back to the upper urinary tract, it might present with a condition called scarring. So this scarring will have an impact on the kidney and will present with a hypertension and end renal disease. So in order to rule out that, you have to do this MCU test after 3 to 4 weeks of treating the urinary tract infection in case of suspecting congenital anomalies of the urinary tract. So the next test is DMSA, which is done 3 to 4 months after treating the urinary tract infection to look for is there any scarring because of the registration of urine. So if at all the scarring is been ruled out, you can avoid the end kidney stage disease to avoid the complications. So any child presenting with the first episode of urinary tract infection less than 1 year should be done with ultrasound abdomen, MCU test and DMSA. And the same presentation within 1 to 5 years, child must be done with ultrasound abdomen and DMSA. If any one of this is having an impact or any positive results are there, you have to go for a MCU. Any child presenting with urinary tract infection after 5 years, you have to do ultrasound abdomen, and if at all there is some negative or any impressions in ultrasound, you have to go for the MCU and DMSA test. So these are the management of urinary tract infection and the recurrent urinary tract infection presenting with any underlying congenital anomalies of the urinary tract. So how all can we prevent urinary tract infection? So first is self-hygiene. So self-hygiene of the perineum can avoid the urinary tract infection. Next is hydration. Make sure the child is going to have proper hydration of 1.5 to 2 liters of water or oral liquids. Third common is try to avoid constipation in children, because avoiding constipation will increase the amount of urinary flow. So in vice versa, it's going to prevent the urinary tract infection in constipated children. Next, ask the child to void the urine frequently, once in every 3 to 4 hours, so that the steam will be good and there will be no storage of urine in the bladder, which will again cause a urinary tract infection. So ask the child to urinate frequently. So the next most common prevention is any child, particularly male child, if you are presenting with urinary tract infection, try to look for any tight bound foreskin of the prepuce, which is called as phimosis. In that children, the child might have a recurrent episodes of urinary tract infection. So in that case, in case of phimosis in male children, it's better to opt for circumcision, removal of the foreskin to avoid the next episode of urinary tract infection. So the take home message is urinary tract infection can be treated very easily if at all it's picked early, and if at all there is going to be any underlying pathology, it should be ruled out even in the first episode of urinary tract infection to avoid the end kidney disease. So make sure the child is going to have a proper hygiene and make sure the child is going to have a proper hydration. So if at all the child is going to present with all these features of urinary tract infection, be cautious and treat the urinary tract infection in early to avoid the further complications of kidney disease. Thank you.